perhaps here in America not talk enough about the balance issues? For instance, things that impact the inner ear, things like vertigo, because we really don't think about it, but as we age, our balance changes,
Sure.
our brain changes.
Sure.
There's things that will do that. It seems to me as if, and I'm glad you brought up Tai Chi and some of the other Far Eastern disciplines, because
Sure.
they teach a
Balance.
very balanced life
Correct.
and a core balance.
Correct.
We need to think more about that, I think, here in America.
Absolutely, we do. I think in general we do. However, I would also offer the fact that vertigo is something a little bit different. Vertigo is something where the dizziness persists. The dizziness can be coming from the way that we perceive our surroundings. That's a little bit tough to explain in very basic terms, but basically our brain is able to interpret our space and time because of a certain anatomical structure in our ear called semicircular canals. I'm sorry for getting complicated. However, it's sort of the way that our brain interprets the position based upon gravity. And if that's not working right, to be sort of simplistic, your brain may interpret that you're in a different position and be trying to correct you. So basically, that's a lot of what can contribute to what we classify as vertigo. And some medications can treat that directly, some medications can treat that indirectly, and it's important that you discuss that with your doctor. It's important that it gets worked up. It's important that there's some evaluation. There's some simple head maneuvers that your doctor can teach you. Not Dr. Google, but your doctor can teach you to do so that you can do those safely. And in very significant complicated patients that may have a complicated history and cardiovascular history, those are things that you should definitely speak to your doctor about before you try to do these things on your own to try to correct your own vertigo. You want to try to be careful with that. So vertigo sort of opens another window, and again, persistent intensifying dizziness with visual changes is something that is maybe even an emergency and warrants a visit to an urgent care or an ER.